The last thing I want to talk about in terms of education is what I call the 1-2 punch of the two constitutional amendments, CACR 12 and CACR 6. CACR 12 passed different versions in the House and Senate, would give the legislature the full discretion, those words are in the constitutional amendment concurrent resolution, to decide what assistance the state provides to local communities for education. The second constitutional amendment, CACR 6, requires a supermajority for any increase in any taxes or fees. So one of them says, we only have to give you whatever money we want, and the other one makes sure that we don't have any to give you. So I call that the 1-2 punch. The House has passed both of those. The Senate has passed a version of CACR 12, the funding piece. I don't know what they'll do with the supermajority piece, but I think those are problematic as well. 6 months ago, we were talking about the fact that New Hampshire is one of the healthiest states in the country. And Rich talked some about some of the health and human service issues. And again, there have been significant cuts to services for the developmentally disabled. There have been significant cuts to services for 8,000 of the most seriously mentally ill in our state. There have been cuts to child health prevention services. Because then where else do they go? They go to the community health centers, of course, because that's the safety net. That would be the safety net before the local welfare office that we've eliminated now, and now we're cutting funding for the community health centers. And while they have talked about not increasing taxes, there's a couple of big taxes, actually, that they did increase. The hospitals, we collect what's called a bed tax in the hospitals. It allows the state to then get a match, a federal match, 50-50 match from the feds, and that help us with our health and human services costs in the state. And then we return to the hospitals that practically dollar for dollar, they get the money back for what's called uncompensated care. So the care that they are required to provide to those that don't have insurance. I think it's also if they're under reimbursed for Medicaid and Medicare as well. So it's for services that the hospital is required to provide that they don't get paid for. And so we've decided, the broader legislature, I can safely say no one up here, has decided that we should just keep $116 million of that and put it in the general fund instead of returning it to the hospitals. So what's the consequences of that? Well, certainly one possibility is that there are layoffs at hospitals. That means longer waits or less quality, not because of the individuals, but because of the lack of staffing at hospitals, more layoffs. It also will mean that those of us that are fortunate enough to have health care insurance and businesses that provide health care insurance for their employees will be paying more for their health care insurance because those premiums will go up because the hospitals will have to be reimbursed for somewhere for the services that they provide, or they go out of business. And probably not so much here in Portsmouth, but in a lot of parts of the state, the local hospitals actually are some of the largest employers in the area, so that'll have a significant job impact as well. And 6 months ago, we were talking about the fact that New Hampshire had the second fastest job growth of any state in the country. Well, I think that's going to come to a screeching halt. We've heard some about some of the job loss. 1,500 jobs, more than 500 of them currently filled, will be cut from the state level jobs. There will be cuts at UNH. The contracts that Health and Human Services and other state contracts with nonprofit organizations all over the state to provide services will go down, and so it's estimated that there will be about 2,500 jobs lost in nonprofit organizations around the state. Last night on NPR, the same segment that Paul Holloway was on, there was a gentleman that works for Pike Industries, which is a highway construction company that has probably about half of its business construction jobs from the state because they do the roads. They said that if this budget passes as is, they will have 100 people at least that they will not be calling back to work. So you just look at that little bit and think about what the negative ripple effect is for all of those people who no longer have jobs, who then are faced with unemployment, some of whom are already, you know, maybe marginal, and so now they need services that, of course, we've cut from the budget, and they therefore are also not out shopping in the local stores and using other local services and having instead a very positive impact on our economy. And I think that the majority would say, or I know that the majority would say, these cuts are necessary. All these cuts that we've talked about, they're necessary. Because after all, we have to live within our means. You know, I have a slightly different take on that. Not that I don't think we have to live within our means, I do. I think that this budget does not represent living within our means for a number of reasons. One is that they have, in my estimation, and actually my estimation is based on economists that have come from regional and state economists and their projections for the state that say that the revenue estimates are probably a couple of $100 million under what will come in. Okay, you generally start out kind of low when you're doing estimates anyway, because we're estimating out to 2.5 years. March and April are really big months for state revenues, and so when the House does their estimates, we don't have these big months to judge by. And as you go through and you get more data, you know, okay, are we on track? Are things coming in the way we predicted that they would come in? The Republicans passed a House resolution that said, we don't care what happens to the revenues. We're not going to increase our estimates. We are going to not spend another penny. If we get $500 million more than we anticipated, we are going to cut taxes. So I understand that they ran on no new taxes. I don't think what they told the public was that they would cut taxes. They've already cut the tobacco tax 10 cents a pack. I would venture to guess that if I go anywhere in this state and I say to people, I want to offer you two options. We can cut the tobacco tax 10 cents a pack, or we can serve 8,000 people in our state that have the most serious mental illnesses. Which do you think we should do? You know what? I live in a great state, and I am absolutely positive that the vast majority of people in this state will say that we should be helping those with the most serious mental health issues. So why are we cutting the tobacco tax by 10 cents? Why are we cutting the car registration by $30 when that means over $100 million, that means about $100 million out of the Department of Transportation, 30 million of which goes to local communities to help build their own local, do their own road maintenance and construction projects locally. That's some of what will cost the 100 jobs at just one company, Pike. So they're not only talking about not raising taxes, they're talking about cutting taxes. Again, I don't think that's what people bargained for when they went to the polls last November. I hope I'm right about that, because I do care about my fellow citizens. I know my colleagues up here care about sharing with you some of what's going on in Concord. If you disagree, you will make your voices heard. Even if you agree, we hope that you will make your voices heard. And hopefully that will have an impact on the outcome before our work is all said and done in June. The last thing I just want to mention, although it's not an afterthought, it's pretty serious, about the budget, doesn't have anything to do with money, and that has to do with the collective bargaining amendment. That was another Kirk amendment that was put into the budget. It had no public hearing. It was a non-germane amendment. It would effectively end collective bargaining in our state. It is not unlike the tactics that were used in Wisconsin. It came in at 6:30 at night, all but one of the reporters had left. There were very few public members left when it was brought up and voted on. And hopefully, at the very least, the Senate will reject the end of collective bargaining in our state. So that's, unfortunately, the lowlights of the budget. But I think what we're planning to do now is hear from you, answer questions from you on anything that any of us have spoken about or any other issues that you have.